people start to realize our differences aren't as big as they seem.
I couldn't really understand the magnitude of what was going on.
I know a lot of people were affected.
You know, it's still that divide.
From the All Indiana Podcast Network and Wish TV, this is Our City, Our Voice.
You look a lot different at it.
Everybody was kind of spinning about what it was and what was happening.
Everything's changed.
From Wish TV, I'm Katira Winfrey, and this is Our City, Our Voice on the All Indiana Podcast Network. On this episode, Eskenazi representatives tell me 80% of all chronic diseases can be reversed or prevented through proper nutrition, but the community around the hospital is considered a food desert, so some of the lower income families and even student population may have trouble getting what they need. The Fresh For You market sits just outside Eskenazi Health's main entrance. Inside, there's a kitchen and neighborhood-type grocery store. Finding a place like this is hard when you're living, working, and going to school in what's considered a food desert.
That's very convenient for the people, very convenient for the people. It's very much needed in the community.
It sits right along the bus line, making it easy for shoppers like Adrian England. He's been here before when the space was just a restaurant and is amazed to see what it's become.
Especially people who work, who have to go have kids, have to feed families, stuff like that. They can just go right here,
That convenience is part of the reason why the hospital decided to expand the market from just a space inside the hospital cafeteria to this. Seth Grant is the director for Systems Food Strategy for Social Determinants of Health. And this initiative is taking aim at improving health outcomes.
80% of all chronic diseases can be reversed and or prevented through proper nutrition. And that's a big number.
Grant says the hospital is able to identify patients who may face food insecurity and provide vouchers so people will be able to shop traditionally here with no one knowing they're using the vouchers. But the food, he says, is just one of the ways they'll use this place.
Is actually make it a patient resource center. So when someone's struggling to find other resources within the community, we're using this as a point of contact to connect them.
Although England isn't a patient here, he's a shopper and says he'll spread the word. From Wish TV, I'm Katira Winfrey. Be sure to like, follow, and subscribe to this podcast, Our City, Our Voice, and discover even more at allindianapodcast.com.
Discover more at wishtv.com. And when you follow Wish TV on Facebook, check out more podcasts from the All Indiana Podcast Network now at allindianapodcastnetwork.com.